I'm starting the streaming for YouTube.
All right, cool. Recording here.
All right.
And recording here. Perfect. Rolling, rolling. Not focused. Go. There we go.
Whenever you're ready, Andy.
Go for it, Britt.
Of Eastern Medicine, Dr. Lee. Welcome to the show.
Oh, it's a pleasure to be here.
So personally, you have changed my body and my life, so I wanted to bring you on the show to talk about everything that you do that can help so many people.
Well, I've treated you for so long, and to watch you through that whole journey has been also my pleasure, my joy to get you better and healthy.
Healthier body.
Yes.
I wasn't aware, I think like a lot of people, was wrong internally with my body that Western medicine wasn't fixing.
Yeah.
And I know you have a bit of a personal story of how you got into Eastern medicine from your back, and you had chronic back pain, correct?
Yes. I was actually pre-med. I was going into Western medicine, and but that whole time of studying and not having the right posture, I had a chronic back pain for about 8 years, and allergies as well. So my body wasn't perfect either, and I sought out for myself different help to get myself healthier and better, pain-free, of course. But at the end of the day, after sticking out all the Western medicine, the only option that was available to me, not finding anything severe was painkiller for the rest of my life. And even at that age, in my 20s, I knew that that wasn't the route that I want to take. And so, to make long story short, to my continual fight to not get acupuncture because I was studying Western medicine. My parents were pushing me to get acupuncture. Finally got acupuncture, and in about 3 months of treatment, my 8 years of back pain was completely gone. It was so life-changing for me to not have pain in my life that I've actually decided to change my career, my future. And so I got into Eastern medicine, wanted to know how putting needles and in a person's body can heal 8 years of back pain, and even to this day, my back is still good. So I'm a firm believer, and because I've experienced it myself, of the power of acupuncture.
A complete life change, because they had told you you were going to be on painkillers the rest of your life, and it's like the dependency or the addiction that could come with that, on top of just, in a way, masking what the issue is.
Right.
And I
not
think
fixing the source, right?
Correct. So acupuncture takes different levels of needles, correct, and puts them in what places of the body. How do you determine that for a client? What they need?
So with acupuncture, we don't look at just symptoms. When two people come in with exactly the same back pain, the diagnosis could be completely different. Their source, where the back pain is coming from, could be something completely different. So the treatment will be different accordingly. So we need to first find out where that symptoms are coming from, and to finding the root problem is the key to Eastern medicine. And so we after diagnosing, examining the patient and getting to the root of their symptoms collectively, we figure out which points are going to balance the body in order to resolve the manifestation of the root problem. The manifestation being those pain that the patient is suffering from. So thus, if we treat the source of the problem, the pain does not come back. The body no longer needs to give that signal. Okay? And so we're able to resolve the, not only the pain, but getting the body healthier so that they're not continuing to develop that same pain over and over again, having to depend on painkiller and different means of treatment to get better.
And so people come to you for many different issues. It could be nerve pain, it could be
all kinds of pain, actually.
Yeah, organ pain, it could be even emotional pain, right?
That's right.
So you had said before people can also be treated for mental health through acupuncture. Can you explain that?
Yes. Eastern medicine doesn't just treat the physical body. Okay? It treats the emotional body, mental body, as well as the spiritual body. Because Eastern medicine believes that the body is a whole. We don't separate the body into parts. So the emotional component of the body can affect the mental aspect of the body as well as the physical part of the body. For example, the person is under a lot of stress for a long period of time, they're going to develop some kind of physical ailment, okay, that's tied to emotional stress or emotional health. Vice versa, someone who is in physical pain or in cancer for a long time will be affected emotionally and mentally. Okay? And so seeing the body as a whole, we treat the body emotionally, mentally, spiritually, and physically. And thus, a lot of the emotional problems, okay, anxiety, stress, depression, post-traumatic syndromes, many of the emotional conditions can also be treated with acupuncture. Why? Because those emotional imbalances are connected to the organs as well, as many of the organs, our vital organs, control different emotions.
That's so interesting because I think a lot of people either do, you know, they go to a psychologist or psychiatrist, or they do other avenues of Western medicine, and not to say that those things can't be paired with this, they can, but I don't think a lot of people know you can actually do a lot of treatment for acupuncture for emotional and physical.
Yes.
So if I come to your office, say, and I've never been to you before, how are you going to determine what to treat in my body without me kind of divulging everything, like, Dr. Lee, my hip hurts and my back and all these things, and I'm sad today, or whatever it is. How do you determine what your patient needs?
When a patient first comes in, they have lists of symptoms that want to have it resolved. Okay, I take all their complaints, okay, not just their main complaints, but the little health nuisance that they have for many a long time. We also take that into account because those are all tied in together. And then, but again, as I mentioned before, those are just manifestations. Bodies scream for help. That's not the main problem. The problem may lie underneath, deeper, okay, within the body, and that we need to check to see the energy of the person, specifically the energy of the person's vital organs. Each of your vital organs control different parts of our body. And if we can find a way to know the condition of each of your functioning vital organs and their control over different parts of your body, and bring that organs to a state of balance, then it doesn't matter what the manifestation is, whether it be having pain or whether it be digestive problem, emotional problem, it doesn't matter. We bring the body into a state of balance so that the body can start healing itself and start functioning correctly on its own. In that way, the body will no longer give signals of its imbalance in the form of symptoms.
Right.
Okay.
Well, because you had said if your body is in pain, that's like the last scream for help, right?
Exactly.
Your body's like telling
Way
you,
too
like,
long.
yeah, you're going way too long and need help. Now, I wanted to look at the diagram of the person that you brought in. So this is actually a woman, obviously, but all of these are different channels, right, that you can actually place the acupuncture needles.
Yes.
Can you explain a little bit
Yes.
on here
Sure.
what these channels mean?
Right. Some of you might have seen a model like this at an acupuncture clinic or what have you, or in different places. But this is a map of your meridian system. We are familiar with our skeletal system, a muscular system, a vascular system, the digestive system, different systems within the body that allows our body to function. But within the body, and most importantly probably, and what Eastern medicine deals with, is the meridian system. This is the energetic system. These are pathways to where energy or life force, or we call qi, travels. And it's the smooth flow of this energy channels that allow our body to be nourished with the functional energy that the body requires. Okay? When there's any blockages or stagnations to these energy pathways, then you're going to have some serious problems to your body's function. And all these channels are connected to our internal organs. So each of these channels, there's 12 main channels, are named after the organ that it's connected to.
Got it.
So that's how
So like
the
the
organs
kidneys,
problem.
the gallbladder,
Right.
all of, okay.
Exactly. And I wanted to mention that the organs, vital organs of your lungs, your heart, your liver, gallbladder, stomach, spleen, large intestines, small intestine, urinary bladder, kidneys, all these vital organs can be checked from the pulse. I know we mentioned about how we can check the condition of those organs.
Yeah, you just take, patient's pulse.
Exactly. And these ancients who developed acupuncture realized that we need to know what's going on with inside of the body. And so they developed the pulse diagnosis, in which in the pulse, from the pulse on the sixth position on the right side and the left side, we check the condition of your organ. Okay? And there's 28 different qualities to a pulse. It's not just the speed of the pulse or the strength of the pulse that we check, but 28 different qualities. The quality of the pulse could be slippery, which represents dampness accumulation in that body or in that organ, or wiriness. The pulse could be surging, pulse could be flat, hollow, empty, slow, fast. All different kinds of pulse quality indicates the imbalances of that organ. And when that exists, the body will not function correctly and eventually manifest into symptoms. And through acupuncture on each of these points, dots along these pathways, we're able to balance those imbalances that we find on the pulse. So even if you don't tell me anything that's wrong with you, through the pulse diagnosis and other diagnoses such as tongue diagnosis and abdominal palpitations and different means of Eastern medicine assessment, I'm able to find out what's wrong with the body and eventually put the whole body into health, in which in turn, your body will take care of itself with taking care of the symptoms that you first came in with.
Smart.
Yeah.
Because the body wants to heal itself.
Exactly.
The organ, our bodies are incredible.
That's right.
So if somebody came to you and had problems or chronic pain or things like you did, you said you haven't had to, you do continual acupuncture treatment, right?
Oh, absolutely.
And to maintain the pain-free environment. But how long do you think people would need treat you to stabilize symptoms?
It's a very good question. People usually come in with chronic conditions, right? Rarely I would have patients that would come in when they just got hurt or when they just had pain. Usually they go to their MDs first. So a lot of the patients that I see are chronic conditions. Chronic conditions are patients that have sought out different treatments out there. All that's out there that's possible and nothing helps, so they end up coming to see me. So oftentimes the patients that I see are chronic conditions. So for chronic conditions that I see, the treatment courses are going to be longer. For example, if you just sprained your ankle and came and saw me, those treatments, of course, are going to be less. But while I'm treating you for ankle sprain, I'm also going to check to see if why you might be spraining your ankle often, if there is any problem with your entire ligaments per se, in which case we'll treat you for not just your current ankle sprain, but your entire ligaments and tendons also, as well as other organs imbalances in order to get your body back into health. Usually for chronic conditions, it's about 3 months treatment. Why 3 months treatment? Because it takes 3 months for all of your body cells to regenerate. All of our body cells are constantly regenerating.
Yeah.
They're getting created, they die, and the body gets rid of it and they get recreated. Some cells regenerate faster, some regenerate longer. Whatever the case, in 3 months, all of your body cells have at least regenerated once. So in 3 months period, with acupuncture, because acupuncture treats the body at a cellular level, because we're dealing with energy, we're able to change how the body's cells are regenerating. So many of those chronic conditions or many of those imbalances that your body has been just kind of regenerating over and over again, okay, we're able to change that so that after 3 months, your body should have regenerated into healthier cells, better cells. And of course, in those 3-month period, I'm not seeing you every week, or I would eventually taper you off.
Right.
First time when you come in with with severe symptoms, you need to come in more often because we want to control that symptom and
like
give you
twice
relief
a
first.
week maybe, and then once you get more of the pain managed and the body is healing itself and getting used to the new normal of these cells that reproduce every 3 months, then you're able to come not as frequently. It's more maintaining the healthiness of your body.
And I actually have patients that come in for prevention. They come in once a season, okay, without any symptoms, to stay healthy, and that's a better way of taking care of the body. Taking care of the body while it's healthy, so that you don't have to suffer through many of the
Yeah,
elements.
of course. I feel like a lot of people do it backwards though. Like if you go to your, this is my personal opinion, people can
right.
do it the other way, but if you go to you last and the MD first, it feels like if it was flip-flopped and you tried to do, you know, all of the Eastern medicine practices first and heal the body and get the chi flowing and the energy the right way, the organs and the problems would heal and it would help the injuries dissipate, and then you wouldn't have to deal with the, you know, surgeries possibly,
Yes.
or the you know, deeper healing from going under the knife.
Yeah, I do have patients that come and see me before they go into surgery to prevent that surgery, and I've helped many patients
Yes.
to not actually cancel the surgery that they have planned,
That's
because
so good.
all their problem
They're-
has
yeah,
been
they go
resolved with
back to
acupuncture.
their doctor, and they're like,
Uh-huh.
it's healed. And I know personally, you've helped me so much with my fibroids and cysts and all the reproductive things with females that you help with too. Just so everybody knows, I mean, you've helped me go from needing prescription Vicodin for my cramps from my OBGYN to now having no cramps for the last 2 months, the last 2 cycles, and it's just freed me. And I think that that's felt too with your back pain. I mean, as women, obviously our cycle, you know, we may have PMS or symptoms with that, but to know that there was a different function for my body that wasn't just death pain every month, you have helped so much with that, and that's why I want people to know about you and acupuncture in general and Eastern medicine, to be able to heal the body and to be able to live in a more pain-free environment that doesn't hurt as bad.
Right. Yeah, when you're in pain, it's hard to live your life. Okay? And pain does keep people from how they want to live their life. Okay? So for me, that was the case too. To have back pain continuously every time you wake up in the morning, and to be able to not be able to sit or drive for a long time, and to have that pain finally taken away and have a completely new life. It is a new life. It is a brand new life to have.
And that's what we
those
want.
pain
We want
taken away
people to
from you.
have a great life, pain-free, or at least managing the symptoms in a more comfortable way for their lives.
Yeah, and with acupuncture, we're able to not just mask the pain, but actually get to the root of the problem, okay, and treat it permanently, completely, and getting the body healthier, and really figuring out why the person is continuing to have pain. Okay, and that is possible.
The needles now are different for each person. So some people are apprehensive about getting those needles put in, or they want to say, what does it feel like? So how would you describe how you put in the needle, how it feels?
Okay, the acupuncture needles are very tiny and thin. They're the thickness of your hair. That's how thin they are. There's a degree of different thickness according to different parts of your body where we to insert the needle. But the acupuncture needles are at the tip of the acupuncture needle is round, not sharp edge cut. And there aren't any holes that we're injecting anything. And the reason why that is because the purpose of acupuncture needle is not cut through tissues and to inject things, but rather to go in and stimulate these pathways. Okay, and so when a lot of the patients that experience acupuncture or have fear of needles, is I always tell them, just get one acupuncture. Once you experience that one acupuncture, all that fear of needles that you have, which actually stems from your fear of needles that goes back to your childhood fear of needles, of getting shots in the hospital. But the acupuncture sensation is very different. Okay, you feel a maybe prick in the beginning, and a maybe dull ache, or a like electricity kind of sensation. But once all the needles are in, you feel a sense of just all those sensations just going away, and there's a sense of just peace. And many of my patients actually go into deep sleep during their treatment, even with all the acupunctures in their body.
Interesting. Well, there are so many things that can help with, from migraines to blood pressure to nerves to your internal organs to your mental health, and then also you do cupping. So I wanted to give everybody an example of what the cupping will be like if you are down for this demonstration.
Oh, absolutely.
Okay, so when we come back, I'm going to have Dr. Lee cup my back, and you guys can see some of the Eastern medicine practice directly for yourselves. We'll be right back.
All right. So want to do this?
So you want me to sit, correct? Like this way so that you can put
Okay.
these on, or do you, what's better for you to have this?
Don't worry about this camera. You tell me.
No.
how you
Where
wanna
should
do
we
it.
have her laying?
Wherever you want to do it, I'll move the cameras accordingly. You tell me how you think.
What's
the
best
camera's
for
set
you?
up.
Okay, I need to be standing.
Okay.
Alright.
Or we can have you on the table.
Yeah, I could sit on the table.
Yeah.
Or lay on the table and have your back this way.
Uh-huh.
If you position yourself, I could position around
And then
this.
I think we should look at the orange shot. So if we're gonna, we have to use the white shot. So wherever it looks good.
Well, I'm gonna turn on the camera and once I see it.
So I mean, I could sit like this.
Oh, I
But then you have the camera.
To the side,
Yeah,
or
you gotta be
lay
able to
down?
see- you gotta be able to see
So
the
we can
top.
see your back.
Okay.
Yeah, can you lay on the table? So
Yeah.
theoretically possible?
Do you want something?
No, I think it's okay. If I just
Hold you.
lay like here. Yeah?
Yep.
That looks great. Look at how cool that looks.
All right, so that's good. But he's gonna stand, so that's fine. You're gonna stand and sit.
I'll go like
I could
this.
sit.
All right, perfect.
Yeah, I could sit
Okay.
like
That'd
this.
be awesome.
Make sure you put your arms down though.
Me?
Let's take the mic back. I'll put
I
the mic
will.
back to her side.
I'll just,
You're gonna have to be like flat down like this.
yeah.
You wanna talk to the camera?
I was
You
just
wanna
gonna-
turn the other way?
Here.
I was
I'll put
gonna
this here.
do,
Talk the other, let's turn yourself into the camera maybe, if you, we'll move it to the.
Yeah, how would
a
she
little bit
talk?
back. If you, what if you do it the other way, like that, so you can at least be.
so
You
I,
could sit here at the edge.
No, I like the laying down.
I like
do you,
Yeah.
and I'll just talk to the camera here for a second and then I'll lay down?
Well, let me see how it looks when you're laying down.
Okay.
Oh, that looks kind of cool. Can you come back a little bit, Brittany?
It's like that.
Just that. That
It's
looks
like
hilarious.
that new video everybody's doing where you pull them out of the frame. You know, not the
No, I
Kiki
haven't
dance.
seen- I
You haven't seen that one? You just did it to me. It's like the Zoom or
Go
something.
ahead, stick your head down, and let me see how that's gonna look. Get your pillow if you want.
No, it's okay.
So we're gonna come over the top with our over the top camera. I'm gonna get an over the top camera. Actually, do we have this camera here? Let me train this camera.
Okay.
Here, and then let's do this. We'll put your mic back over here.
Okay. Perfect. So I'll just talk to this
Yeah,
camera.
this one.
At the end of this, you know how sometimes you cut a 1 minute or like a 30-second promo for me? Will you cut one with this part? Thanks, sweetheart. And you can even say, you know, that these old blood stagnations are from treatment yesterday.
Okay.
I just want this to help more people. Acupuncture's been,
Yeah, just getting that information out there.
Yeah.
I realize that there's so many people that still hasn't gotten acupuncture after all these years,
I know.
and many of them don't know.
So put your head, put down, put down a little bit. Okay.
Well, that's a
Maybe
good
go up
shot.
Go up a little bit.
Like
I'll put a pillow
on the
there.
table? Oh,
Just lean your head up for a second, a little higher for the glare. Just want to see. Yeah, I'm going to give you and then you're basically just going to go into the cup area where there's already, she's got the marks already.
he's gonna go around those areas.
Right. Is that good? You like it?
Yeah.
All right. So what's the thing? Where's that green box? Let's take the green thing away and the green box away.
It doesn't even need
That's
those?
his cups.
These are my cups.
Yeah,
That's-
there's a cup.
Yeah,
There's
I
the
think-
cup box. Yeah. Yeah, we can see those in the back.
We'll put that like this.
Okay.
So when he does it though, I usually put my head
let's do it.
down. That's
Oh, that's
okay?
great, yeah.
So yeah, smooth the mic back to the other side of yours, to the other side. All right, cool. All right. So yeah, you can look into the center camera, Britt, if you're gonna talk.
Okay.
That's right on you. That's good. And then right there, if you're gonna hold yourself up like that, that's even better. That's fine.
But when he does the cupping, I have to be
All right, that's fine.
like that. Okay.
That's good.
Okay.
All right, I like it. Let's roll.
All right.
Stand by. Rolling here.
Want to just hear a little sound check from
All
both
right.
of you?
About to get
Sound
cupped.
check. Check.
You take the person away from the pillow there, see if he's done with them. And then take the flame out, take the flame by the cups or something.
Uh-huh.
Perfect.
Just
All right,
Still rolling?
stand by for the split. Let's take a look at the split. Let's see what the split's not gonna look like.
This one, we're not using this one right now. We're only gonna use the white shot and the gas shot.
Let me see the split go. This way, this way. You're not looking at it.
That's what I'm,
Yeah, that's fine. All right, put it back. And
just gonna use this shot and the gas,
Quickly
and the
steal the
gas.
other, what if we put the other box there, that could be cool. You don't like that?
No, I like,
You put the wide shot within the other box, duplicate that, and put the wide shot in the other box.
I don't think so, whatever you want.
Or duplicate, duplicate,
I think it looks just cool like this.
right, we get to go back and forth with it. Right, it could be like this, yeah. That's fine, okay, fine, keep it like this. All right, forget it, here we go, here we go. All right, stand by,
So I'm gonna go too wide.
all right? How about DPS?
So I won't
Details?
put too much. So I'm just gonna show them examples, right?
Mm-hmm.
So just maybe put one here, maybe 4.
Do 4.
You wanna start with
Yeah.
BTS? And then go
Yeah,
in?
sure. All right, bring it in when you're ready.
And, or should I, actually, unless Brittany wants to start saying something to that camera, then and then I go to her wide shot once she's done with the first sentence.
Yeah, you can, talk to that camera up there.
That one instead of this one?
Yeah.
Just for the first sentence. and then
First
we'll get back
sentence,
to-
you'll say to that cam, and then
Okay.
when you go to whatever next, I'll go to your regular
Okay.
cam.
All right, cool. Go for it when you're ready.
Welcome back. I am about to get cupped by Dr. Lee. He has done cupping on me before. That's why I have some previous bruises on my back. So I'll let you explain, Dr. Lee, those areas as well for the cupping and what you're about to do to me with this flame.
Yes. So Brittany has some round marks here. These are the cupping marks. That's from these cups. These are ceramic cups. There are different types of cups: glass cups, plastic cups, and ceramic cups. But the ones that I'm going to be using are the ceramic cups, and they look like this, and they're placed on the muscles, different parts of the patient's body. And the way the cupping works is that the cups, when placed in a body, it creates, well, first of all, I'm going to create a vacuum inside the cup with the fire, which will allow the suction of the skin and the muscles when it's placed on different parts of the body. And when we do that, in our body, there are stagnant bloods. Blood must circulate. If the blood is not circulating, it's stuck in different parts of the body, the body's going to give pain. So cupping is actually used for blood stagnations, for circulations. So when the patient comes in with pain, whether it be on shoulder, neck, or back, or what have you, we place these cups to see where the blood stagnations are, where the blood is not moving. And those areas are going to come out like this dark.
And those
As
are the
such.
areas that need more healing, right?
The reason why it comes out this dark, now, these bruises are not painful, okay? Although it may look dark, these aren't painful at all. The reason why it comes out this dark red is because the blood that's not circulating, these are old blood, dead blood. When we place that cup, do that suction motion, those non-moving blood cells come up to surface, and that's why it turns dark. The dead blood, old bloods are darker. The areas that you have no redness on different areas where she has lighter cupping marks, those are the areas that she has good blood circulation. When the blood is moving, even when we place that cup and create that suction, because that movement, those stagnant bloods don't come up to the surface. So when we bring it up to the surface, the body is able to better resolve that stagnation, and you have fresh blood that is now able to, underneath, flow through it, thus resolving the pain through circulation.
Great.
I'm going to give you an example
Okay.
of,
So you light the flame first, right?
Stand
Okay.
by. Let's take the earrings off for noise. And then we're gonna say you light the flame first. Let's take it with the BTS shot. Don't move. We're gonna light the flame first with the BTS. And then Brittany's gonna start out by saying, go ahead when you're ready.
Okay, you light the flame first, right?
okay. Now there's different ways to light the flame. Okay, I use this device, okay, in order to create a very strong flame. And I would place these cups in here to create that vacuum, and immediately place it on her as such. And it creates, through that vacuum, creates that suction, it sticks in very tight. And we would leave that in for maybe about 10 minutes. Okay?
And it feels
As such.
really tight in the beginning. It feels like somebody is like holding onto your skin tightly, but that pain dissipates after a couple minutes.
Yes, and I actually have patients that fall asleep with all these cups on their back. Now I place these cups not only on back, but these back points also are back shoot points. In Eastern medicine, it's what we call back shoot points. Back shoot points are window to your organ points. So different parts of your back next to the spine indicates different organ system as well. So while we're also treating our back muscles, we're also treating the blood flow to the organs, your vital organs as well. So when I do the whole back cupping, I can see, for example, from the top, the lungs, the heart, liver, gallbladder, stomach, spleen, different parts of your body indicates different organ system, the condition or the blood flow to those organs. So when those areas come out dark red, more so than other, we could also check to see which organs are not receiving good blood flow and thus treat it accordingly as well. So it does two purposes: muscles, creating that circulation, as well as checking the blood flow to your organs as well. Okay?
Which is incredible. So I would leave these on for how long?
For about 10-15 minutes.
Okay, and I'd be relaxed, obviously, in your
Yes.
in the room, and then sometimes you pair this with acupuncture as well.
Absolutely.
So it really depends on what the patient needs. I'm going to sit up like this just for a second, but normally you would stay seated and relaxed. So if you need acupuncture, you can get treatment for all types of body issues, even emotional issues, and you can do cupping as well with Dr. Lee. He is a miracle worker. I strongly suggest you go to him if you're having any type of pain. Don't let it get to chronic pain. Go ahead and let everybody know, Dr. Lee, where they can find you.
You can find me at my website. It's probably the best way, at myacuhealing.com. That's easy. myacuhealing.com. I have 2 offices in Monrovia and Beverly Hills.
Great. I would love you guys all to feel the benefits that it's helped with my body as well. So I urge you to take a different route and try some Eastern medicine with Dr. Lee. For this episode of Purpose, I'm your host, Brittany Zonker, and I will see you next time.
Yay.